Preventing medication errors using health information technology. The development of health information technology has greatly reduced medical errors. Paper-based medical records puts the nurse at risk for making medical errors through poor legibility, poor coordination of data, and the risk of human error. Usage of health information technology is an easy-to-use method that requires the nurse to use all the rights of medication administration. The following scenarios will demonstrate the human errors that can occur with paper-based medication administration and the way that health information technology can prevent these errors from occurring. The first example we will show is a nurse administering medications to the wrong patient using paper-based charting. The patient's name is handwritten at the bottom of the medication administration record, or MAR. These medications are printed on a label and placed on the paper MAR. As you see, the label shows the patient's name, name of the medication, the dose, route, and duration. As the nurse is giving out the medication, she looks at the handwritten name at the bottom of the MAR and checks the patient's wristband to see if this is the right patient. She observes that the names match and administers the medication. Did you catch the mistake? The nurse does not realize that the printed label on the MAR did not match the handwritten name on the bottom of the MAR. The patient received another patient's pain medication. The nurse will most likely continue to give medications to the wrong patient. The second scenario will show a nurse administering medications at the wrong time with paper-based charting. The nurse is called in by the patient with complaints of pain. The nurse reads on the MAR that the pain medication can be given every 4 hours. According to the time and the medication order, the patient is due for their pain medication. The nurse administers the pain medication. An hour later, the nurse goes to check on the patient's pain level and observes lethargic behavior. The handwritten order of pain medication every 4 hours was actually an order for every 6 hours. The order was not written legibly and therefore was mistaken for a more frequent delivery of pain medication. Here we have some statistics related to medication errors using paper-based charting. Medication errors often occur because of distractions and interruptions. In the U.S., medication errors result in at least 1 death per day and 1.3 million injuries per year. There are 3.5 incidents per 1,000 medications administered. Implementation of health information technology will reduce medication errors before it reaches the patient. It's proven to decrease medication errors, and it forces the nurse to follow the 5 rights of medication administration. Some system warnings are below. For the wrong patient, it might say, "Scanned the wrong patient." Wrong medication, it will say, "The barcode you scanned is not correct." For a wrong dose, it will say, "The order does not match the medication scanned." For wrong time, it will say, "Be careful, this medication was given less than 5.5 hours ago. Are you sure you want to administer this medication?" And lastly, wrong route provides a reminder to the nurse.